While the existence of the mutated BRCA-1 and BRCA-2 gene has been well known in the medical community for several years, it wasn't really well known to the public until recently. Actress Angelina Jolie announced in the New York Times that after testing positive for the mutated BRCA-1 gene, which increased her risk of developing breast cancer to 87%, she underwent a double mastectomy. According to the National Cancer Institute, BRCA stands for breast cancer susceptibility genes, a class of genes known as tumor suppressors. Dr. Krishnan Radiologist at Florida Hospital Waterman's Digital Mammography Center explains how BRCA mutations are identified and the importance of annual mammograms.
The BRCA gene is a genetic test that is done to determine if you have that genetic type of composition that kind of makes you more predisposed to breast cancer. Our practice at Florida Hospital Waterman asks patients to come at the age of 35 for their first baseline mammogram, and then from the age of 40 every year. If patients have breast cancer in their family or have a positive BRCA gene, they're asked to come from the age of 30 and then 35 and then start at 40. If your screening mammogram is abnormal, then you have something known as a follow-up known as a diagnostic mammogram, where we'll be doing extra images as well as a possible ultrasound or MRI follow-up. And after the diagnostic workup is complete, we discuss the findings with the patient. 80% of those to 90% of those turn out to be fine, but 10 to 20% of them do proceed to biopsy. Women who are diagnosed with breast cancer in the olden days were dreading the fact that they'd have a mastectomy or a large excision. We minimize the amount of breast tissue taken out.
Traditionally, we have treated the whole breast with radiation therapy using external beam, which means daily treatments Monday through Friday for about 6.5 weeks. There is an alternative for ladies who qualify who have early breast cancers. They could be treated in a matter of a week using a brachytherapy device. And they're treated twice a day for 5 days, which allows you to get your course of treatment done in a short period of time.
Women should be doing their monthly self-breast examination, should be seeing their physicians every year, and getting the routine screening mammograms every year.
Mutations of the BRCA-1 and BRCA-2 genes have been linked to hereditary breast and ovarian cancer. Angelina Jolie's mother died of ovarian cancer in 2007 at the age of 56. Jolie is 37. To learn more about breast cancer and to schedule an appointment at Florida Hospital Waterman's digital mammography services and a link to Jolie's original New York Times article, follow the BRCA genes story link on our homepage at yourhometownhealth.com.